to BW Healthcare World series on quality and safety, organized jointly with CAHO. Our first guest today is Dr. Anna George, who is the Group Head of Quality at Aster DM Healthcare India, having an oversight of quality and safety program for over 16 hospitals. What we would really want to speak to Dr. George today is to understand the aspects of quality and safety from the patient's perspective, as well as understand the hospital's perspective on this. So welcome to BW Healthcare World, Dr. George.
Thank you so much. It is my pleasure and privilege to be here today. Thank you.
So Dr. George, before we deep dive into the conversation, let's begin with the basics. What does quality in healthcare mean to you? Since you are focusing on this particular aspect of the industry, so what does quality in healthcare mean to you, and why do you think it is so important that it must be brought to focus today?
Right. So the word quality is synonymous with basically value for money. That has been always like that from the start. And no matter what we do as a person, not just related to healthcare, but any service or any product we buy, we always look for quality. So why should healthcare be any different? Now, the term quality in healthcare actually has come pretty late when compared to the production industry, for example, where the movement for quality had started many, many years ago. It has come a little later into healthcare and a bit even more later into India, our current perspective. So some of the reasons why this has got importance is basically because for anything and everything we do, it is very important to have systems in place. And it's also very important to be doing the right thing every time. The definition of quality stems from that intent, doing the right thing every time. And of course, the very famous definition called freedom from defects or freedom from errors. Now, if you look at the whole idea in healthcare, or as we doctors take the Hippocratic Oath, the main intent behind that is do no harm. And a lot of the aspects of quality and safety in healthcare stems from this concept of do no harm by ensuring we are always doing the right thing, always for our patients.
So, Dr. George, it's a very powerful statement saying do the right thing. In fact, this is a very human thing. It is should not be restricted to any one particular industry. But we need to follow standards. Somebody needs to set up the standards. What are the factors that have shaped the idea of accreditation in the Indian healthcare system? And, since the system is now there, what are its benefits for the internal and external stakeholders that we are seeing?
So as you rightly mentioned, it's very easy to say do the right thing. But what is the right thing is the question first. And I think that's where these standards help us a lot. It's more like guide best practices. Now, in any industry, in any organization, it's when we say right thing is always time dependent also. What was right 20 years ago may not be right today. And that's where we need to always be updated with the current best standards. And when we say best standards, they're always based on evidence-based practices. It's a lot of learnings from the past errors or mistakes what people have made, and the continuous efforts of people similar to us, healthcare workers, other stakeholders. When I say stakeholders, it's not restricted only to doctors and nurses, but it's also the patients, their families, the inputs received from them that help us to shape this kind of best standards. And a lot of research in terms of the medical practices, the nursing practices, which have helped us to develop standards. And when we say standards, what we follow now, for us, it is the right thing to do in this point in time. Now, when we talk about accreditation, the question that specifically that was asked, these accreditation standards came very recently to our country, though it was there earlier in the West, particularly the US. We have the CAHO standards. Every country have, their own accreditation standards. If you make a comparison across countries, all these standards, the basic intent and the essence is the same. It's always pointing to patient safety. So similarly, we have our NABH, our National Accreditation Board for Hospitals and Healthcare Providers, which got its standards released in, I think, the year 2005. However, from then on, there have been a lot of changes, additions, amendments, which means the journey of quality is evolving. Probably what we started out in the first edition of standards, now we have reached the 5th edition of standards. This itself means that the industry is dynamic. The best standards are also dynamic. They are also changing, and we are continuously raising the bar higher. So I would say, based on my experience and my understanding, the implementation of the NABH standards has played a very important role in making healthcare professionals realize and guiding them in the right way to ensure following best practices.
So, Dr. George, let me ask you one very pointed question. Do you think that the standards that we follow in the West are more evolved than what we follow in India? Before I go to the next question related to this.
Right. So I have had the opportunity to work with JCI accreditation standards also, which are truly international standards. And if you ask me, because we started a bit late, also the concern being the scenario, the healthcare scenario is very different in India when compared to the West. We are struggling with accessibility, primary healthcare. We are struggling with volumes, sheer volumes that we face in our hospitals, the kind of diseases, and the kind of mix that we face. We are struggling with a lot of issues in the past years, and I feel today we have evolved, definitely, but we are not looking only at cities or metros. We also have to look at the rural areas where healthcare still may not be as accessible as we are fortunate to have in the cities. So when we struggle with these problems, we cannot just go by one standard, one platform. This is for all. It has to be in different levels. And as I always say, quality is a journey, never a destination. So it's always about, have you done better today than where you were yesterday? And we are, to some extent, definitely influenced by what we do in the West, not because they're the West, because we have a lot of learnings, probably people who have started earlier in certain things, we share the learnings. After all, health is a global phenomenon. It's not something just, the problems we face are also problems what other countries face or other people face. So now, because of the global connectivity that we have, the approachability and the accessibility we have to information around the world, definitely we have got a lot of learnings that we have from other countries, not necessarily the West, from any country around. And we are still evolving. However, the intent, and there's a lot of similarity in the standards that even, the other countries or the West follows. And as I always say, the intent is always patient safety.
So, Dr. George, what steps has India taken to adopt and put into effect the global standards for quality and accreditation? Keeping in mind that, India is a very unique country, and we still have access issues into the interior part of our country, whereas the dichotomy is that we already have a very evolved healthcare system in the cities.
So one of the first steps even the NABH has done is getting accredited by ISQA, which is the International Society for Quality. And that accreditation itself means that we have another senior body which is accrediting our standards. That could mean actually that the standards are acceptable, on a global level. That is one of the steps. Second is the development of the standards have been with the inputs from a lot of our senior leaders in healthcare who have a lot of experience on the ground. Let it be clinicians, let it be nursing, let it be administrators. So a lot of thought process has gone into developing these standards. Third is there is a lot of feedback that is taken from the stakeholders and the hospitals. every time the edition is a new version comes in or a new edition comes in, there's a lot of feedback that's taken from the hospitals and healthcare providers who are actually adopting and implementing these standards. So this is how, from the Quality Council of India, they ensure that feedback is received and the modifications done accordingly. Coming to the second point, very pertinent point about how far are hospitals across the country able to implement these standards. So again, this is the reason why NABH has put in that option for entry-level standards. And as I said, it's a journey. So you don't always have to reach the top. You can start with entry-level standards. You can move into full accreditation standards a bit later. And these are all process changes that we need to make, which cannot be done overnight. There is also a huge culture change. And I think that's one of the reasons we sometimes find it difficult, because it has not reached a stage where such topics are discussed in the primary level of medical education. When you come to medical colleges, when you come to nursing colleges, these things are not really discussed. What is discussed is the technical part of the education. And it's difficult for anybody who has trained for 5 years or 8 years coming to work and somebody being told, oh, you need to do it this way, or you need to, do things in a different way. So that's not very easy. So it would be always good if we can inculcate these kind of concepts from the beginning, because the culture change has to come right from the beginning. It's always difficult to change somebody or practices later on. So it's always good to inculcate these learnings from the beginning.
So, Dr. Anna George, what, in your opinion, are some of the challenges we are facing as a country in terms of implementing the quality and accreditation in India? Is there something specific that CAHO is doing to promote this culture of quality and overcome the challenges that we are facing?
So some of the challenges, as I mentioned before, one is definitely the challenges we face in India, because it's not the same in every part of the country, right? With regard to accessibility, affordability, even knowledge, the fact that some of us are very fortunate that we have access to the knowledge and learnings may not be so for everybody across the country. Secondly, the fact that the knowledge sharing happens at a later stage in your medical career, whereas initially you're only focusing on the technical aspects of your subject. The terms like quality, patient safety, and all come a bit later. Sometimes, most of the times, when a hospital is actually going in for accreditation. So it's very similar, as I say, as I always compare it to exam. You have an exam, so you need to learn. And suddenly there's a crash course happening because you want to score good marks. But learning is not just for the exam. Learning is to develop wisdom. And that wisdom actually helps you change lives. So this concept is what we believe has to be adopted in quality and safety, where it is a way, it should be a continuous way of doing things, rather than just doing something because the accreditation standards demand it. Now, this is where I feel the knowledge gap has to be bridged. And that's where CAHO, Consortium of Accredited Healthcare Organization, which is a nationwide network, now also gaining momentum in the international circles, is doing its bit to close this gap through trainings. Now, when we say trainings, training also should not be available or accessible only to privileged few. It should be freely accessible, because knowledge, the more you spread knowledge, it is the level of healthcare in our country that's improving. So it is with this thought process that CAHO has launched a lot of courses, free webinars, a lot of portals available for people to access. Being a member of CAHO can help you gain access into all these different there are self-paced learning courses, there are certification programs, There are a lot of interesting discussions and webinars that are transmitted. However, if you ask me, during our discussions, because I'm also a governing committee member of CAHO, we realized that it's not just doctors and nurses who are the stakeholders. It's also the general public, and educating our patients and families is very important. And I want to also mention this important fact that the WHO has raised this program called Patient for Patient Safety Program, which has a lot of impact on patient safety, because involving and empowering patients and families forms the crux of safe patient care. Many times in the past, especially, probably you and me have also experienced that many years ago, where the doctor or the nurse has the last word, and we are scared even to talk back or say something. Gone are those days. So now always, it's always the patient is at the focus, and every decision of the care plan, treatment, is taken in consensus with the patient. We cannot, think that the patient may not understand what we are saying, and let's just not talk about it, because it's their right that they understand, and it's their right that they, in consensus with the doctor and nurse, only undergo whatever treatment or care plan is there. Now, this Patient for Patient Safety Program focuses on making the community, that means involving our patients and families, in knowing more about patient safety. That means asking the right questions, being convinced that this is the right thing to do. And as part of this program, it's important to reach out to them also on these safety initiatives. And that's where I feel we need to extend our knowledge to these people on similar platforms, so that it reaches out to common man and not just healthcare professionals. And this is something that CAHO is doing now, beyond training professionals, also reaching out to the common man through platforms, which are social platforms, which are freely available to other people.
So how is this program being accepted by the hospitals? What is their, how are they getting impacted?
The training programs and other things, the collaborations that organizations have, hospitals have with CAHO, as I said, again, bridges this gap, because the knowledge gap is always there. And we are all familiar with the word attrition, where people come and go. You need systems to be robust, because people come and go into the organization. It's always required to update knowledge and to ensure that anybody new coming in is also updated with that knowledge. One of the very good points that we have seen, or the good benefits we have seen, is association of hospitals with CAHO helps them to no need to search for knowledge, because it's all there, a repository, connections, and more importantly, from an industry point of view, it is a networking. There is a nationwide networking of healthcare professionals, and we learn from each other. Whenever we have any issues or any discussions or concerns, it's always good to discuss with industry experts, rather than sitting in my small area and thinking I know best, or thinking this is all that we need to know. Exploring what everybody else is doing, or are there better ways of doing this, is something that comes through this wide network. And this is where, and of course, CAHO has a lot of conferences. We have our annual conferences where best papers and publications are made. So it is learning from best practices that also the hospitals can benefit from.
And Dr. George, how does quality and accreditation help in overcoming medical legal cases or situations for the healthcare provider?
So I know that people suddenly take note when you use the word medical legal case. And for the longest time, we did not have to worry for so much, because people were not so aware about this aspect. But today we live in a world where left, right, center people raise medical legal cases. One important factor is the knowledge of the people that this is doable, and the main highlight or something that is always looked into from a medical legal perspective is medical negligence. And the test to prove medical negligence is, was the current standard of care followed? And this is exactly what we are doing by ensuring that we follow the evidence-based practices or the best standards. So the fact that earlier we did not have written down policies or procedures, we did not have clinical protocols or pathways that people follow, we did not have certain standards which are prescribed by accreditation bodies. Today we have all of this. And establishing these facts is what helps us to prevent a litigation or, somebody putting a medical legal case. Medical legal cases still do happen, but everything boils down to, did we do everything right for that patient, which is accepted at that current period in time? So I feel a large extent of your medical legal cases can be resolved if you just stick to the standards and follow the best practices for that period of time.
Since you were talking about patient safety, now patients are becoming more aware of their rights and responsibilities as well, and they also understand their the quality and acceptance of quality, the minimum standards, and they know that they have an option to file medical legal cases for negligence if there is worthy of it. How is this being accepted by the healthcare fraternity, the hospitals? Are they taking it kindly, or is there a pushback from the hospital?
See, the awareness is there everywhere. And I feel that awareness ensures that people are, they are more cautious. And they need to plan ahead or put a strategy ahead to ensure they are doing the right thing always. So earlier, probably people didn't need to think so much. And we have heard this word that has been practiced a lot, but it's called defensive medicine. We hear that a lot among the healthcare fraternity. But yes, to some extent, yes, because of the fear that medical legal cases or some litigations may come up. However, if you ask me, sometimes you need to be a little defensive because you're dealing with life. Sometimes you have to be absolutely sure you're doing the right thing. When you say right thing, it is only based on your best practices, what is available at that point in time. I cannot say 20 years back we were doing this, so it's still right now. The onus is on me that I be updated and I ensure I know if there are better practices to be done, have I followed that? Now that is where we need to continuously update ourselves and ensure we are doing the right thing. And to some extent, I feel that that factor of concern, I wouldn't use the word fear, but concern that, these things can be raised and it might become an issue, helps us to ensure we are updated and to follow standards and policies.
Got it. My last question to you, Dr. George, is what do you think we need to be talking of on the subject of quality and patient safety to reinforce the idea of quality and the responsibilities towards a patient?
From a healthcare perspective, the doctors and the nurses, or
what do you think? I mean, all of us need to be talking of to create that awareness.
Yes. So one thing I would say has happened good is because the concept of accreditation, having standards, now has struck a chord even with third parties. For example, if you have insurance and you have even when it comes to international tourism, medical tourism, for example, wherever there are other stakeholders there. For them, accreditation is a requirement because it basically says you're following certain standards of care. To some extent, this has played a role in necessitating that this should be done. On the other hand, the knowledge of doctors, nurses, as well as administrators on the benefits of accreditation, similar to the ones we discussed just before, insisting or ensuring we have policies, SOPs, good clinical practice guidelines, is also gaining impetus throughout. Now, organizations such as CAHO have actually contributed a lot to this, because it's when we go into common forums and you see people similar to you who are discussing these things, implementing these things, we realize that there is a need for doing the same, even in our organizations. For the same reason, as I stated, bridging the knowledge gap is where CAHO has got a vertical called Quality Professionals, the QP, Quality Professionals Wing, where every month there are online webinars on very specific topics, again, with the only intent of continuing quality education. So we talk about CMEs, continuing medical education, CNEs, continuing nursing educations, and now we have the concept of continuing quality education. And this is not restricted only to managers or administrators. This is for basically clinicians, nurses, technicians, paramedical staff. And that's the beauty of CAHO. It's open to everybody. There are no restrictions. Now, we feel that quality is a term which is top driven, which means your topmost person, be it a director, be it a CEO, be it an MD, they have to be quality conscious or patient safety conscious. So earlier, when you talk about healthcare or any organization for that matter, we are more interested in volumes, revenue, those kind of things. But now we have parameters for measuring quality, because whatever is not measured cannot be monitored. So these are parameters that go into the top leadership reviews and reports. And it has to be top driven, however, percolating through and through the organization to every staff. Every staff means be it the nurse or the housekeeping or the security or the lift man, the hospital assistants, anybody and everybody, and definitely clinicians in the forefront. So this kind of an approach, which goes through and through the organization, is finally what can get us where we are or where we should be better than yesterday.
You brought up a very, very important point when you were talking of it's a top-driven approach, but it has to percolate down to even the non-medical staff. Because many a times what we think is that when we are thinking of healthcare, it is the healthcare professional. But we do not realize the importance of the quality being trickling down to a housekeeper, because the hygiene could be one of the biggest compromises on the quality of healthcare provided. So thank you for bringing out this point. I love the fact that we spoke. In fact, we initiated the conversation with quote unquote saying that, we need to do the right thing. And that is what drives the intent with which healthcare needs to be provided. It is so important, when you spoke about the current best standards need to be updated, almost every day. And, you spoke about the continuing quality education. I think that's a beautiful step towards ensuring that everybody has the responsibility and the accountability to keep themselves updated, so that, that's the service that they need to provide to somebody who is coming with faith to seek care from an expert. So, these are beautiful points that came out of this conversation, Dr. Anna George. I thank you so much for taking our time to speak on this very, very important topic. This is a series that we shall continue. to ensure that patients get the best care that is available to them from doctors and professionals who are continuously updating themselves with what is the latest that can be used to serve the patient. Thank you so much for your time.
Thank you. Thank you so much.